Hi, I'm Dr. Tim O'Carrigan, orthopaedic surgeon. I specialise in foot and ankle surgery and limb reconstruction. And today I'm going to talk about leg length discrepancy. When we grow, there's two sides to us, and it's very, very common for people to grow slightly at different rates on each side. Now, if you line up a lot of people on the street with no problems that they're aware of and very carefully measure their leg lengths, you'll often find variations of a few millimeters, even up to a centimeter, where people are completely unaware, and that's within what we call a normal range. When your leg length difference starts to get above a centimeter, people can become aware of it. And the problems that occurs is that it puts stress on people's backs. And the reason it does that is that to accommodate the leg length discrepancy, we often have to have a tilt in our pelvis, and that causes a tilt in the spine. And over a long period of time, that can contribute to progressive back pain problems. So the main complication of a leg length discrepancy over time is often the development of back pain. And that is a very common reason why patients eventually become aware of a leg length discrepancy. And by correcting a leg length discrepancy, you can even up the pelvis, take stress off the spine, and often vastly improve or completely relieve that back pain. Leg length discrepancy can be caused by variations in natural growth patterns, so that's called hemihypertrophy, and asymmetrical growth. And that can occur in completely normal people and can sometimes lead up to substantial discrepancies of 3 or 4 centimeters. Trauma can also cause a leg length discrepancy. So where somebody has had a fracture, and that fracture can heal with shortening, or if it occurs during childhood, it can sometimes affect a growth plate, and that can slow down the rate of lengthening and lead to a discrepancy getting worse over time whilst they're growing. The other common cause of leg length discrepancy is part of a huge range of conditions that can affect children and their musculoskeletal system, and that can go from congenital musculoskeletal disorders, illnesses during childhood, cancer, many other causes. Whatever the cause of leg length discrepancy is, the effect is to cause a limp, and that can lead to back pain and other problems over time. It also does tend to put stress on other joints such as the hips and the other knee, because when one leg is short, it's a little bit like that knee is constantly going up steps, and that can over time put a lot of stress on the other leg. The other problems that can occur with leg length discrepancy can be malalignment, and that is where the bone or bones are not straight, and that can lead to uneven pressure on joints, and over time can lead to arthritis problems. And finally, the rotational alignment of legs can also be abnormal. So one leg can be internally rotated or excessively externally rotated compared to the normal range, and that it also can have effect on the hip and the knee, or if it's in the tibia, it can have effect on the knee and the ankle. And so when somebody comes in with a leg length discrepancy, we're not just looking at their length alone, we're looking at the alignment, we're looking at the rotation, we're looking at the range of motion of all the joints of the lower limb, and taking all of these factors into account to decide to identify what the actual problems are and then how we're going to address those problems. And we have to customize the treatment to address all the elements of that individual person's problem. And that's one of the really interesting things about limb reconstruction, is that it's not standardized. There's a huge range of problems that we have to deal with, and a huge range of unique solutions that we can come to to help a patient overcome the problems that life has dealt them.